Good afternoon. Today we will be talking about esophagram, an examination of the esophagus as well as what other procedures might be helpful to get the best results for our patients. When conducting an esophagram, a radiographer looks for abnormalities or conditions affecting the esophagus, such as strictures that are narrowing, tumors, diverticula, hiatal hernias, gastroesophageal reflux disease, or swallowing difficulties. To get the best diagnosis, there are three different methods to help to get the most efficient results of the esophagus: Byron swallow, high resolution manometry, and transnasal esophagoscopy. An esophagram, also known as the Byron swallow, is a radiologic procedure used to examine the esophagus, the tube that connects the throat to the stomach. During the procedure, the patient swallows a contrast material, typically barium sulfate, which coats the lining of the esophagus and enhances visibility on X-ray images. This procedure is performed by a radiological technologist or a radiographer and is used to diagnose conditions such as strictures, tumors, or swallowing difficulties. Transnasal esophagoscopy is an endoscopic procedure used to examine the esophagus using a thin, flexible endoscope inserted through the nasal passage. Unlike esophagram, which use X-ray imaging, TNE provides direct visualization of the esophageal lining and allows for the detection of abnormalities such as inflammation, ulcers, or tumors. This procedure is typically performed by a otolaryngologist, someone who specializes in the ear, nose, and throat, and may be used to evaluate symptoms such as difficulty swallowing or chest pain. High-resolution manometry (HRM) is a diagnostic technique that provides detailed information about the esophageal motility patterns and pressure dynamics. It involves the placement of a catheter with multiple pressure sensors along the length of the esophagus to measure intraluminal pressure changes during swallowing. HRM allows for the assessment of esophageal peristalsis, lower esophageal sphincter function, and the detection of motility disorders such as esophageal spasm or infective esophageal motility. HRM is considered the gold standard for evaluating esophageal motility disorders due to its superior sensitivity. HRM offers more precise and comprehensive assessment of esophageal function. Together, esophagram Byram swallow (HRM) and TNE provide a comprehensive evaluation of the esophageal anatomy, function, and pathology. This multidisciplinary approach improves diagnostic accuracy, guides appropriate management strategies, and ultimately enhances patient outcomes in the management of esophageal conditions.